So I am Dr. Sara Thomson. I'm an OB hospitalist here at Saint Alphonsus Regional Medical Center. In June, we started a process of testing moms when they get admitted to labor and delivery. And the reason that we did this is because some of the OB literature has shown that women can be asymptomatic or pre-symptomatic and still carry the virus, and it could be contagious to her baby, her family members, or healthcare workers. We've had some moms who have asked us what the risk of having a false positive test is going to be and what kind of tests we're using, so I wanted to address some of those questions today. So the tests that we use here at Saint Alphonsus are all pretty sensitive tests. They are a PCR-based test that looks for the RNA of the virus from the sample. The risk of having a false positive test is quite low. We have a couple different testing platforms or machines that we use to do the tests. For women that are getting a scheduled cesarean section or women who are being scheduled for a medical induction, we're having them get tested the day before they get admitted to the hospital. So you will be given an appointment time in the day before your scheduled induction or C-section. You will come in for the swab, and that test is run on a machine called the Panther, which takes about 4 hours and runs overnight. So we will have the test available in the morning when you get admitted. For other women who come in labor without a scheduled birthday for their baby, we're doing a test as soon as you get admitted for delivery. That test is run on a machine called the Cepheid or BioFire. We have both platforms available here. They take about an hour to come back, and again, these are pretty sensitive and specific tests that we use. Once your test comes back, if it is negative, we feel comfortable having you remove your mask in labor if you feel better doing that. The only time we'd ask you to wear the mask in labor is if you're walking around the halls where you could be exposed to other families, or if you're in your room and a healthcare provider comes in, we may ask you to put your mask back on in that scenario. And finally, I just wanted to share with all the pregnant moms out there that even if this birth experience isn't the same one that you've been dreaming of your whole life, or even if it's different from the one you had with a prior child, we can still make it a positive experience, even if you are unfortunate enough to become ill with COVID-19 around the time of your labor. Thank you so much for watching this video, and I look forward to participating in your care and giving you the best birth experience that we can during this difficult time.